Good afternoon, ladies and gentlemen. Today we are going to look at pharmacology. That is, I'm going to focus my discussion with ZRN7, which is the January 2019 or July 2019. Sorry. So this afternoon we are going to look at pharmacology 2,2,2, which we are starting. I'm sure we are done with pharmacology 1,2, and now we are on pharmacology 2,1. So this will be the area of focus this afternoon. So remember, in pharmacology 1 we covered topics such as in pharmacology 1 we covered topics such as first of all, we covered topics such as antibiotics, drugs that are used in the urinary system, drugs that act on the cardiovascular system, drugs that work on the GIT, and so on and so forth. So this morning, because we are looking at 2,1, we are still going to focus on drugs that work on certain systems. And this morning, this afternoon, we are going to basically focus our discussion on drugs that work on the endocrine system. So with the endocrine system, the way it works is we are going to look at drugs that work on the endocrine system, and of course they're going to be subdivided. For before we actually even go any further, it's actually better for us to have an understanding to say drugs that the endocrine system itself. The endocrine system itself is a complex collection of glands that produce hormones. So this is the system, actually, the endocrine system. It is a complex collection of glands that produce hormones. And these hormones, what they do is these hormones are actually chemicals that control basic body functions. These hormones are actually chemicals that actually control various body functions. So what is basically the functions such as metabolism. So these hormones are actually chemicals that are produced by glands, and these glands actually produce these hormones, and these hormones are actually refer to them as chemicals that have play a various role in the body functions, such as sexual development, such another one is actually metabolism, then also in growth. So these hormones are actually produced by the endocrine. Remember, the word endocrine itself, it comes from a Greek word. We have the word endo, which actually simply means within. Then we have the crine, which actually simply means secretion. So endocrine is actually a complex of collection of glands that produce hormones, and these hormones, in other words, we are saying these are chemicals that control basic body function. And what are these major functions that these hormones do? They play functions in metabolism. They facilitate in metabolism. They also facilitate in growth. They also facilitate in sexual development. So these hormones are actually very important. So our objective for today, or specific objectives today, is we are going to discuss drugs that actually have an effect on the endocrine system, especially the corticosteroid drugs. So these are drugs that we are going to discuss today. Of course, the corticosteroid drugs, we know to say the corticosteroids produces two major hormones. That is the cortisol itself and other hormones that it produces. But what we are focusing is rather today is actually the corticosteroids, which are actually produced by the adrenal cortex. So we are going to look at the hormones that are produced by the adrenal cortex, and now we are going to look at these drugs that have an effect if there is a limited amount of hormones that are produced by the adrenal cortex. What are these drugs and what is their primary function on a human body? And we are going to discuss these drugs and what will be the effects of these corticosteroids. So remember, before we actually even discuss the corticosteroid, which is actually the main interest of today, or the main area of today, we are going to first actually do to say, remember, we have several hormones. The body has several hormones, so not hormones that several hormones that are produced, and these hormones are produced by the certain glands that are found in our bodies. And one of the example, these glands are actually quite a number of them. We have, of course, the pituitary gland, we have the pineal gland, we have the thyroid gland and the parathyroid gland, we have the adrenal glands, we have the pancreas, the thymus, just to mention a few. So now today we are going to focus about hormones or that are produced by the adrenal glands, and we are focusing on the corticosteroids. So these are actually hormones that are going to be produced by the adrenal cortex. And what is the function of the corticosteroid hormones? So that is the area of interest today. That's what we are going to be discussing this afternoon. So this is what we are going to be discussing this afternoon. So to continue from where basically we stopped, remember we said that the corticosteroids, which is basically that produced from the adrenal cortex, they are produced from the adrenal cortex, which is the adrenal gland. The adrenal gland secretes a number of steroids, which are the corticosteroids in this case. So it produces a lot of steroid hormones, and among these steroid hormones we have the glucocorticosteroids, mineralocorticosteroids, and also certain sexual hormones that are produced by this adrenal cortex. And we refer to these as the corticosteroids, drugs that we are going to discuss that have an effect on when these are secreted in lesser amounts. So which drugs are these now that actually have, we are going to use actually as, which drugs are these? So remember, corticosteroids are naturally secreted by the adrenal cortex. That's what we said, as cortisol and cortisone. However, some hormones can actually be synthesized. Some hormones can actually be synthesized. And what are the examples of the synthesized corticosteroid hormones? So examples of the synthesized corticosteroid hormones, we have prednisolone, betamethasone, dexamethasone, hydrocortisone. So these are examples of synthesized corticosteroids. So which means these are synthesized hormones that actually can be given to your body and will still have same effect like the normal ones that are produced by the body. So remember, these we are discussing about corticosteroids, and we said these corticosteroids are naturally secreted by the adrenal cortex, and they are secreted in form of cortisol and cortisone. However, there are certain hormones that actually can actually be synthesized. You can actually make them even in the laboratory. And examples of these synthetic corticosteroids, we have, for example, prednisolone, betamethasone, and dexamethasone, and hydrocortisone. What is the pharmacological action of these drugs that I have mentioned, or the synthesized hormones that I've mentioned here? So remember, corticosteroid influence usually on growth and development. So these corticosteroid drugs or hormones that are synthesized have an influence on growth and development. So what is their primary functions of these corticosteroids that we are talking about? So they have about 4 major functions. So one, they are involved in metabolic effects. So corticosteroids have synthesized corticosteroids, or these corticosteroid hormones have primary function number 1, which is a metabolic effect. So what do they do this in metabolic effect? What's really their primary function? They increase the blood glucose level by facilitating the conservation of stored glycogen, especially in the liver. So they facilitate an increase in blood glucose level. Hence, when we look down, one of the contraindications of the corticosteroids, you discover that it is one of them is actually they are contraindicated in people who have DM. It's because in this case, corticosteroids facilitate an increase in glucose level, blood glucose level, and we understand people who have DM, diabetes mellitus, usually the glucose level is usually high in blood. So if you give these drugs, it means you are going to worsen the condition of this particular person. Now that they are contraindicated in those DM. So we are talking about the primary functions of the corticosteroids. We say major primary function number one is metabolism, and under metabolism we are saying it actually increases the blood glucose level. Number two, under metabolism also it increases the lipolysis and fat distribution. So it actually, these corticosteroids are also important because they are involved in the breaking down of the fats that is found in your body, and this fat that is broken down, it is equally distributed all over the body, so that you are not having not too fat. So they are important in that aspect also. So these also under metabolism, corticosteroids play a major role into promoting catabolism, which is breakdown of larger molecules into smaller molecules. So they also promote catabolism. They also promote anabolism effect in the liver. So that is primary function number one of the corticosteroid. They play a major function role in metabolism, and we have explained how do they play a role in metabolism. We said one, by increasing blood glucose level, by increasing lipolysis, which is definitely the breakdown of fat into smaller particles. Then we also say these have a primary function of immune response and regulation of inflammation. So mostly when you look at the corticosteroids, most of them are actually used as anti-inflammatory agents because they reduce the inflammation. How do they do this? They reduce the inflammation on the body by reducing vasodilatation and edema. Remember, when you have inflammation, there's usually vasodilatation that is taking place as a result of histamine that is produced. So these are going to inhibit that histamine. If histamine is inhibited, so there is also going to be there will not be vasodilation at that particular area. And if vasodilatation is inhibited, there is vasoconstriction. It means there will be no fluid shift from the region of there will be no fluid shift from within the cells to the extravascular spaces. There will be no that shift of fluids. So they also inhibit these. Remember, we said they also inhibit prostaglandin synthesis. This corticosteroid inhibit prostaglandin synthesis, which is a vasoactive substance. So it means if they are able to inhibit prostaglandin, it means that they can also inhibit the pain level, because prostaglandin is usually associated with the pain. So they also inhibit platelet activation leading into bleeding disorder. So they can inhibit the platelets, and if platelets are inhibited, it means someone is going to have bleeding tendencies. So they can inhibit especially those people who have thrombus. So if you want to give to dissolve that thrombus, you can give these corticosteroids, because they have a tendency of inhibiting platelets, so that their blood is dissolved and there will be bleeding disorders. So you can actually give these drugs. So that is basically the function of these the corticosteroids. They are also immunosuppressive agents, so they reduce antibody production. So they inhibit the immune system by inhibiting the antibody production. So these can also be given as immunosuppressive agents. So how are they given? They inhibit the production of antibody, reducing the cell migration white cell migration and inhibit inflammation. So these corticosteroids also have an action on the GIT, and on the GIT they reduce gastric mucus secretion and increase hydrochloric acid and pepsin production, leading into ulceration. That's what these drugs actually, these hormones can do to your body. They have an action on the GIT, so if they are in larger amounts, they will reduce gastric mucus secretion and increase hydrochloric. If hydrochloric increases in the stomach, of course, and the pepsin production, this is going to lead into ulcerations. And if there is also increase in hydrochloric levels in the stomach, it affects someone to have gastritis. Are we together? So this is the effects of these hormones, the corticosteroid hormones on your body. So remember, we're looking at these drugs that are found that are among the corticosteroids, like the prednisolone, betamethasone, and also, just to mention a few. We said these drugs are found among the corticosteroid drugs, which we said the primary function, this is what we are just from looking at. So the mode of action of these corticosteroid drugs, they decrease basically inflammation. They decrease inflammation by inhibiting vasodilation. So if vasodilation is inhibited, there will not be edema that will be reduced. So there will be no shift from fluids from this within the cells to the extravascular spaces. So it decreases inflammation, and this drug also suppresses the immune response. So they are actually not advisable in patients that actually have a lowered immune system, because if you give these drugs to a patient that have a lowered immune system, it means their immune system is going to be further be decreased, it's going to be suppressed, hence this patient will be prone to infection. So they are not actually advisable, but they suppress the immune response. These drugs also stimulate the bone marrow and influences protein and fat and carbohydrate metabolism. They are important in fat, protein, and carbohydrate metabolism. So what is the indication of the corticosteroid drugs that we mentioned? So we say the corticosteroid drugs that we mentioned is prednisolone, betamethasone, dexamethasone, hydrocortisone. What is now, we say the indication of these drugs. So we've already talked about the mode of action. So they suppress the inflammation, which we have already talked about. They suppress the immune system, and they also have an influence on metabolism of fats, carbohydrates, and proteins. So what is the indications of these drugs, the prednisolone, betamethasone, and just to mention a few. So these drugs are basically used to treat a number of disorders, especially on inflammation and immunological disorders. But primarily we use them, of course, on treating or counteracting the effects of inflammation. So they have other effects. So these drugs actually can actually be indicated in adrenal insufficiency. So if the adrenal gland, remember we said the corticosteroids hormones are actually produced in form of cortisol and cortisol. So under the cortisol and cortisol, we have actually various hormones that are actually produced, such as the glucocorticosteroids, mineralocorticosteroids, and sexual hormones. So these hormones, if the adrenal gland has any disorders of the adrenal gland, then it is going to lead to certain things. Just a second. So yes, we continue. We're looking at the indications of the corticosteroid drugs. So remember, the corticosteroid drugs are produced in form of cortisone and cortisol. So the indications of these drugs, remember we said they are primarily used in inflammatory conditions. So we have conditions where there is, for example, adrenal insufficiency. We can use these drugs or these synthesized hormones if a patient has a condition where the adrenal cortex has insufficient, has difficulties in producing these hormones, so you can give these hormones to actually be a supplement, because in this case the adrenal cortex is not producing any hormones, so you need these synthesized hormones to go and perform the various functions that we mentioned. Remember, these hormones, like we mentioned earlier on, that are produced by the adrenal cortex have functions on, they have a play a major role in metabolism. So again, they increase the blood glucose level They also play a major role in protein, carbohydrates, and fat metabolism. They also have a role in and they play a role as they can play as anti-inflammatory agents. That's what these drugs can do. And just to mention a few that we discussed about earlier on. So if a patient has adrenal insufficiency, you can actually give these synthesized hormones as supplements. Then remember, if someone also has arthritis, remember arthritis is an inflammatory condition. It's the inflammation of the joint. So in this case, you need to give, the reason why you are giving them, because they will act as anti-inflammatory agents. Then you can also give them as immunosuppressant in organ transplants. So once you want to reduce the immunity of an individual, especially when you are doing an organ transplant, because you don't want the immunity to be so active, so you reduce the immunity of that particular person. You give these drugs because they will reduce the immunity of this particular individual. Then you do the transplant, so that there won't be antibody reaction. So you reduce the immune system of this particular individual when you're doing an organ transplant. So you can give these drugs. You can also give in examples of dermatitis, when someone has an inflammation of the skin, the dermis. So you can give these drugs. Then in allergic reactions, you can still give these drugs. So those are areas where these, among others, that you read on your own. What are the contraindications of these corticosteroid drugs? So remember, the like we mentioned from the function that we looked at. So these drugs should not actually be used in patients that have diabetes mellitus. Why shouldn't they be used in patients that have diabetes mellitus? It's because we mentioned to say these drugs actually increases the blood glucose level, and we understand to say in patients that have diabetes mellitus, the blood glucose level is usually high. So if you give these drugs, it means you are going to increase and hence for worsening the condition of this particular person. So apart from that, these groups of drugs should not be, they are contraindicated or should not be given to patients that have ulcers, because remember, they have an effect by increasing pepsin and hydrochloric acid. They increase pepsin and hydrochloric acid in the stomach. So if someone has peptic ulcers or gastritis, please, they are contraindicated. These drugs are contraindicated in these types of patients. Otherwise, the pain, the gastric pain that this person is going to feel is going to worsen. So because of the hydrochloric that will be increased. So that is what we are talking about. So what then are the adverse effects? We are looking at adverse effects of these drugs in general. We will look at them in detail one by one. So the adverse effects, we have peptic ulcers. Peptic ulcers, which is one of them. Peptic ulcers is one of them. Then number 2 is poor wound healing. Why is there going to be poor wound healing? Normally, inflammation should take place so that the white blood cells can be taken to an area where there is an infection. So remember, these drugs, they arrest. What these drugs is, they arrest vasodilatation. It means if you are there will be vasodilatation will be inhibited. Vasodilatation will be inhibited, which means if it is inhibited, there will be lesser white blood cells that will be traveling to that target, that area, and those white blood cells should go macrophages that should go and engulf bacteria in that particular area. And if there is no macrophages that goes, or white blood cell that goes to that particular area, it means infections will have an opportunity now to affect that particular area, that inflame the particular area. Hence, there will be poor wound healing in as effects of these drugs. Another one will be also immune suppressed. So these people are going to be their immunity is going to be suppressed. Usually, they are going to be suppressed, so they are prone to infections. You can come in, sir. They are prone to infections because of that. So we continue. Sorry for that. So we are saying they have an adverse effect. The adverse effect will be an individual, the immunity will be suppressed because of what we discussed earlier on. Then apart from that, we said peptic ulcers, because they increase the hydrochloric acid. They can also lead into another condition that we refer as hyperglycemia, because they increase glucose level in blood, so they can lead into hyperglycemia. So just to mention a few. So now let's look at I have a question for you that you might want to think about. So now that we have looked at the corticosteroids in general and what their indication is, their mode of action and the adverse effects, and we have done probably a review of the anatomy. Remember, we have done a review of the anatomy. So what then is actually explain how corticosteroids can predispose someone to have diabetes mellitus. Explain, the question is, explain how corticosteroids can predispose someone to have diabetes mellitus. So you have to discuss that. We have already discussed it. I don't know whether you can recall it. So in case you've forgotten, or okay, if you have remembered, well and good. But in case you've forgotten, remember the primary function of the corticosteroid hormones is basically, one of them is in metabolism. They increase metabolism. So one is metabolism effect. So in metabolism, they have several functions what they perform these corticosteroids. One is they increase the blood glucose level. So it's because of that increase in blood glucose level, the insulin will be unable to convert the glucose into glycogen. So hence you have this particular person having diabetes mellitus, because the insulin will eventually fail to convert, to consider it as normal. Hence you have a patient having diabetes mellitus. So now let's look at these drugs individually, examples of the corticosteroid drugs from the groups of the glucocorticosteroids. So examples, we look at them individually. Number one, we have prednisolone. So prednisolone is the first drug that we are going to look at, and mostly we know this drug because we usually give it in an inflammatory condition as an inflammatory agent. So we give it as an inflammatory agent. So in this case, anti-inflammatory agent. So prednisolone has a lesser mineralocorticosteroid activity, longer duration of action than cortisol, and it has an inflammatory agent and suppresses the immunity too. So this drug basically, usually when you have inflammation, is usually the first drug that they would prescribe for you. So it has an inflammatory agent and also an immunosuppressant agent. So that is prednisolone. So prednisolone, the presentation of prednisolone, it is either supplied as 5 milligrams, it comes as 5 milligram tablet, it can come as 5 milligrams tablet, It can also come in form of an injection. An injection comes with 25 milligrams per ml. Then it also comes also as 100 milligrams per ml. So those are the presentation of this drug. And the pharmacokinetic of this drug, it is readily absorbed when you take it orally. It is readily absorbed when you take it orally, and it's distributed literally, distributed to the muscle, skin, intestines, and the kidneys. That's where it is distributed. It's distributed to the muscles, skin, intestines, and the kidneys, and it is metabolized basically in the liver. So metabolism of prednisolone takes place in the liver, excreted as inactive metabolites and small unmetabolized drug in urine. So it is excreted through urine. So you actually can have an idea, now that we have looked at the pharmacokinetic of this drug, you can actually have an idea of what the side effects of this drug will be, in as much as we have already discussed the general signs and symptoms of this drug. So we're talking about prednisolone, which works as anti-inflammatory agent and an immunosuppressant agent. So it means if someone has an inflammatory condition, so for example arthritis, you can actually prescribe prednisolone. If you want to also use it in an organ transplant where you are trying to avoid antibody antigen reactions, you might want to give prednisolone so that the immunity of this particular individual is lowered, so that they reduce on the antigen antibody reactions. So the presentation we have already discussed. So it comes as a tablet, 5 milligrams, and as an injection, which is 25 milligrams per ml and 100 milligrams per ml. So the dose in severe inflammatory and immunosuppression, we give in adults we give 2.5 to 15 milligrams. That is per oral 2 to 4 times in a day. So we give 2.5 to 15 milligrams in a day. That is a severe inflammatory condition. So we give 2 to 4 times in a day. So you can give that. Then you can also give 2 to 30 milligrams. That is IM, 2 to 30 milligrams IM or IV. That is 2 times daily. That is in severe inflammatory conditions. So in case someone has inflammation of has an inflammatory condition and it's severe, please, that is the dosage that you use. So that is actually prednisolone. The side effects of prednisolone, like we have discussed earlier on, I'll just refer you to what we have discussed earlier on. So one, it suppresses the immunity of an individual. So it suppresses the immunity of an individual. Two, there is delayed wound healing in this when you give prednisolone, just to mention a few. Three, is it actually increases the likelihood of someone having ulcers. It increases the likelihood of someone having ulcers because it increases the secretion of pepsin and hydrochloric acid. That is prednisolone. The mode of action we have already discussed earlier on of these drugs. So the second drug that we are going to discuss today is actually dexamethasone. Dexamethasone is another anti-inflammatory drug that we use from the corticosteroid group. So what this drug does is it is also an anti-inflammatory agent and also an immunosuppressive. It has an immunosuppressive effect. So the presentation of this comes as a tablet and injection in various strength. So it comes as a tablet or an injection, but it has various strength. So it has so many various strengths. It can come as many dosages. So it is readily absorbed orally. It is readily absorbed orally. So when you take it orally, it is readily absorbed. So pharmacokinetic of this dexamethasone. So absorption after an injection depends on the site of injection. It is distributed to the muscle, the liver, the skin, the intestines, and the kidneys, just like we discussed in prednisolone, and it is metabolized in the liver. So, and of course, it is excreted through the kidney. And it is excreted in urine through the kidney. So the dose of this drug depends, because we can also use it also these drugs. Remember, they arrest vasoconstriction, they inhibit vasodilatation. So if they they inhibit vasodilatation, it means these groups of drugs have an effect. These groups of drugs have an effect on controlling edema. So if there is vasodilatation is inhibited, there will be no edema reduces also, because there will be no shift of fluid. There will be no fluid escape from the intracellular to the extravascular spaces. So there will be no shift of fluids. So this drug can actually be used. We say it is an anti-inflammatory agent and can also be an immunosuppressive agent. But also it is important to note that we can use it in a patient that have edema. For example, we can use it in cerebral edema. So use the dexamethasone sodium sulfate. In adults, you give the dose of if someone has cerebral edema, you give 10 milligrams IV. So you give dexamethasone. If someone has cerebral edema, 10 milligrams IV. Then you give it. Then you give 4 to 6 milligrams IM 6 hourly. So that's how you give this drug until the symptoms suddenly subside. So until the symptoms suddenly subside. But in inflammatory conditions, if someone has an inflammatory condition, you give 0.75 milligrams to 9 milligrams per day. You can give that. Then another drug that we are going to discuss, the side effects, of course, they are literally the same. So another drug that we are going to discuss this afternoon is hydrocortisone. Hydrocortisone is also used to treat people who lack adequate naturally generated cortisol. So it is basically used to treat people who lack adequate naturally generated cortisol. And the presentation of this drug is usually 100 milligrams per vial, which is an injectable, or 50 milligrams and 100 milligrams per tablet. That is the presentation of hydrocortisone. So the dose usually in these people who lack adequate generated cortisol, you basically give the dosage of 100 milligrams to 200 milligrams IM or IV 3 times daily or 4 times daily, depending on the indication. In children, we give 0.16 or 1 milligram BD 2 times daily or 3 times daily, depending on what the physician or the doctor has prescribed. What are the necessary considerations then that you should take, or what are the considerations that you should take when someone is on these corticosteroids? So what are these necessary interventions that you need to take? So there are so many necessary considerations that you need to take when someone is on these corticosteroids. So patients receiving long treatment of steroids require a double their usual dose if they develop a moderate infection, or triple the usual dose for severe illness to compensate for the deficiency production of the body. So before a surgical operation, also a surgeon a surgeon must be informed if the patient is receiving or taking steroids due to anti-inflammatory and immunosuppressive effects. So if someone is going, before they go to the theater and they're about to go for a certain operation, you need to inform actually the one who is there, the doctor who is there, the surgeon who is there, to say the patient that I'm bringing to theater is actually on these corticosteroids, and the doctor should then take into consideration. Remember, these act as anti-inflammatory agents. They act as anti-inflammatory agents, and they lower down the immunity of a particular individual. So the person who is there actually should be very wary. If treatment with steroids lasts for more than 10 days, withdrawal must be gradual. The withdrawal must be gradual, as adrenal suppression will have occurred. So if the treatment of these corticosteroids has lasted more than 10 days, then when you are stopping this drug, you shouldn't just do it just then. It should be gradual. Reduce the dosage until when finally you stop. It's because the reason why is by then they would have suppressed the adrenal gland, would have occurred by then. And number 4 is patients must be taught not to stop taking steroids suddenly to prevent corticosteroid deficiency. So, like we said, if someone is on these corticosteroids, please, if they are stopping, let them not stop on an immediate, on a sudden note. They need to stop on gradual basis, because it might actually, these drugs can suppress the adrenal gland. The adrenal cortex might stop producing, and the body might actually take it as normal, because you take them daily, so suppression might have occurred. So you gradually withdraw, so that the adrenal cortex will start secreting these corticosteroid hormones. And you also have to carefully monitor the side effects of these steroid drugs, because we said one of them is actually ulcers and so on, just to mention a few. And random blood sugar should actually be checked if the patient is on long-term treatment or is on these long-term treatment of these steroids. So random blood sugar should actually be checked. We've said the reason why you need to check random blood sugar. So the reason why you need to check random blood sugar is because these drugs actually tend to have an effect. They tend to have an effect in increasing the glucose level, blood glucose level. So hence, when you are using these drugs, you need to actually check the random blood sugar when you're on these drugs. So remember, we are talking about drugs that have an effect on the endocrine system. And with the endocrine system, we started talking about drugs, the corticosteroids, which are basically, these are hormones that are produced by the adrenal cortex. And the adrenal cortex, these are so we're talking about the corticosteroids. So these hormones have various functions which we have discussed. So they have an effect on the they have an effect on the GIT, they have an effect on metabolism, they have an effect on inflammation, and they have an effect in lowering the immune system. So they have so many functions, these hormones that are produced by the adrenal cortex. So in cases where the adrenal cortex or the adrenal gland has deficiencies, so you need actually to give these synthesized hormones. These are drugs that are made in the laboratory. These are synthesized hormones. And the examples we say the prednisolone, the dexamethasone, hydrocortisone, just to mention a few. These are hormones, synthesized hormones that you need to give to this particular individual so that their normal daily activities continues. Metabolism of fats needs to continue. So that's the reason why we need these drugs. So remember, when we give these drugs, they have adverse effects, and this is, we're discussing what they are missing considerations that you need to take into consideration when you're giving on these drugs. Then we went ahead to discuss these drugs individually, and most of them you realize, like I said in my introduction, when we were looking at the corticosteroid drugs or corticosteroid synthesized hormones, to say these drugs are basically used if basically to counteract the inflammatory effects. Also, they are also used as immunosuppressants. So that's what we say. And when we discussed these drugs, it was literally what I said earlier on. So that's what these drugs actually do. So I hope we have enjoyed this little short interaction that we had. So now I have questions for you. So it's multiple choice question. I hope you just go through them. Where are the corticosteroids secreted? Where are the corticosteroids secreted? So number 2 is not an example of a corticosteroids. So we have option number 1, betamethasone, option number 2, dexamethasone, option number 3, hydrocortisone, option number 4, levonorgestrel, which is option number 4. So that has been a lecture in pharmacology on drugs that have an effect on the endocrine. To be specific, drugs, hormones, drugs that or the corticosteroid hormones. So we're discussing about the corticosteroid hormones. So remember, these hormones can also be synthesized, and we have talked about the indications when you can actually give these particular drugs. So that has been the discussion for today. For any questions, any clarifications, please kindly note you can actually comment on my Facebook page, and better still subscribe to my YouTube channel, where you'll find you can also, when you subscribe, you can ask questions. Remember to subscribe to my YouTube channel where I'll post this video. Please subscribe and tell your friend to subscribe, and also you can watch it on Facebook. You can subscribe to my YouTube channel and watch it also on Facebook, but the link will lead you direct to my YouTube channel. Please have a lovely day. It's been a pleasant being back online. Enjoy. This is basically for the 7. Thank you. Thank you.